Welcome to Ready to Heal. This is your host, Betsy Sawyer Galen, and this is the show where we talk about everything that has to do with alternative healing. Some of the methods you've heard of before, and some of them I'm sure you've never heard of. And today my guest is Dr. Alan Dattner. Thank you for coming.
Oh, thank you for inviting me, Betsy.
He is a holistic dermatologist, and we're going to talk about how you got started doing holistic dermatology. How did you come to that from a traditional background?
Well, I finished my residency and training at Albert Einstein College of Medicine and wanted to do something more exciting. And I went to the dermatology branch of the National Cancer Institute, where I continued my immunology research. And our work there demonstrated the nature of how the immune system, the lymphocytes, recognized one thing and compared it with other things in the body. And we were investigating what was called cross-reactive recognition. And when we did that work, and the data that we got was very suggestive of the fact that one kind of exposure could sensitize you to something in your body so that you would react against it. And then I knew
So
that...
can you give me an example of that?
Yeah. For instance, there are certain viruses that if you get that virus, it induces a response not only against that virus, but against, say, the islet cells of the pancreas, and you get type 1 diabetes. It wipes out those cells.
Oh, like what type of virus?
It's I don't have the name of it offhand, and that information may be evolving, but very specific virus. So there are a lot of relationships like that. There's another relationship that a streptococcal infection in certain people can induce the formation of a type of psoriasis called guttate psoriasis.
Ah.
So once you take that and expand that concept, you realize that there could be things in food, there could be bacteria, viruses, all kinds of different things that could set off a response. And of course, food is the biggest exposure we have. And the microorganisms in our gut are also a major exposure, 100 trillion organisms, give or take.
So tell me a little bit about that, because a lot of people have issues with food and they don't really know what they are. I think a lot of our society has issues with food. And it might be just as simple to them as indigestion. They don't know if it has any other ramification beyond that.
Well, often issues with food and bloating and various gut symptoms are a sign that there's an inflammatory response going on in the colon or in the small intestine. And that response may generate cells that go out into the body and attack other places. And I believe that that's one of the causes of a lot of skin diseases. And we have some very specific ones that are well known, such as a condition known as dermatitis herpetiformis, which involves the extensor aspects, especially of the extremities, the upper arms, where people eat gluten and they get little blisters. But this is a very well-defined condition. It's a particular type of pathology under the microscope, but it's an example of what's probably happening in less well-defined conditions.
So it would happen to people who don't have, per se, a gluten allergy that they know of?
It could happen to people who have other kinds of sensitivities. Now, gluten and certain microorganisms like yeast can cause inflammation of the gut wall. And inflammation of the gut wall can lead to a breakdown of the junctions between the cells, so it's sort of like opening up a fence so things can get through. And we call that condition leaky gut. As a matter of fact, I have a diagram of that I'd like to show you.
Okay.
And this is in my book, which I'll show you as well. So here we have...
And that condition is actually related to other health problems as well.
Once you have material escaping, so here you have a nice tight boundary, and material doesn't escape out of the small intestine. But if there's inflammation and that boundary breaks down, or if there's gluten, or if there's overgrowth of yeast or certain microorganisms which are not yet all determined, then you get a breakdown barrier, and then materials can escape through that boundary into the blood, into the lymphatics, and create havoc elsewhere in the body, either by becoming targets themselves or inciting damage against targets that look like them. Does that
Ah,
make sense? I know it's a kind of a
can you give an example?
well, yes. For example, normally we would breaking everything down into either amino acids or one, two, or three, one or two amino acid pieces. These are little peptides, we call them. But if they're much bigger, like 6 or 8 amino acids in the peptides, they become recognizable by the immune system. The immune system sees them, they
Uh-huh.
fit in the groove of the lymphocyte, and there can be a reaction. There are also some of these peptides that have 8 amino acids, if from milk, for instance, can be can be physiologically active. So that there's one called caseomorphine. Now you recognize caseo as
Right.
casein milk,
Casein, right.
and morphine you recognize as being soporific. So you can actually uh, be drinking milk, partially breaking down the casein, but not completely, having a leaky gut, and then going to sleep or getting psychoactive problems. And some people with ADD or ADHD, or even perhaps some individuals who have autism, are having problems with that.
Uh-huh.
They're getting a drug hit from their milk.
Uh-huh. Oh, interesting. And you're bringing up milk because that is a common
Because it's a common
cause.
food, and it doesn't mean that milk necessarily is a problem for all people. But you have to have a particular equation here. You have to have incomplete digestion, and you have to have a leaky gut, and you have to have this tendency to overreact to it.
Uh-huh. So how common do you think that is in the public?
Well, if we expand this and think about all of the other possible peptides that could be coming from foods and all the other possible molecules, I think that there are a lot of people who have inflammatory conditions who are reacting to something either from their food or something that comes back up from the colon, some bacterial product that causes trouble. So you may have an instance where one thing causes inflammation, say the gluten or the casein, and then that opens up the door, and then something else gets out.
Uh-huh.
So it's
Ah.
not just a one-hit equation.
So let me ask you a question that goes back
Yeah.
to when a patient comes to see you, and now you always use the holistic approach, or sometimes you use a traditional approach.
Well, I've studied dermatology and medicine and immunology, so I have the background. And there are times when somebody has a severe infection, and they really need an antibiotic, or they have a tumor and it has to get cut out. Sometimes I'll use those techniques. Other times, who have those kinds of problems will get care from a regular dermatologist. They don't need to come to me for that.
Uh-huh.
Um, but I can make choices across the full spectrum, which is important because sometimes you spot somebody who really needs something different, and if your background doesn't extend, you may not send them in time.
Right, right. Well, let me take an example of like we were talking about earlier, an issue of acne, which I had as a kid.
Mm-hmm.
How would you go about treating me um, in a less traditional way? And I did get traditional treatment. I think it caused me a lot of problems down the line, health problems. So
Mm-hmm.
I'm very interested to hear of a better technique.
Well, I go under the assumption that skin problems are really more of a symptom than actually a disease. We get this idea of calling them a disease, and it's really, to me, a symptom. It means that there's something else going on in the system that isn't working right. So I start looking backwards along the causal chain to see what's going on. So I look at it as acne is actually being caused by inflammation, and that's been proven more recently, but wasn't the thinking uh, 20 years ago. So I'm looking for a cause of inflammation. So there's some foreign substance that's getting there to me,
Mm-hmm.
besides just the acne bacteria in the skin, which most people have. And what's the biggest source of foreign materials entering the body? Our food.
Right.
So I start looking for foods that are causing trouble. Now, when I first started training, the old timers took away milk because they seemed to cause acne. Then, when antibiotics came, it was too difficult to take away milk, so they just gave the antibiotics.
And I know chocolate was always
Chocolate
said to be a
was,
problem.
and then chocolate was proven in an article back in the late 60s or early 70s not to cause acne, but then that article was proven to be false. And also there are a series of articles now demonstrating a relationship between milk and acne. So we've come around in a circle here that now we know that there are certain foods that have been linked statistically to acne. So I believe that there are other foods too, and my experience with patients over the past 3 decades has proven that, and it's different for different people. So if a person is allergic to a given food, in the food allergy sense, not necessarily having the same kind of allergy as we would have with an inhalant, they may well have an outbreak. So the first thing I do is take away certain foods that are suspected by them or by me. And the second thing I do is try to fix the digestive system and try to reestablish a more normal population of organisms in the gut to reduce the inflammation that's involved. And then when that's done, I can go on and use substances that help heal that barrier, bring that back tight. And when I've done that, the person's a little more resilient. And then I start addressing other factors. Maybe there are hormonal aspects that are involved. Usually with young women there are.
And how do you address that?
I use natural substances and herbs that affect hormones. And according to how the patient appears and according to what I find from testing.
So, and I'm interested in talking about that a little bit too. What type of herbs do you, is this like kind of like Oriental medicine, those type of herbs, or is it a different?
You know, I take things from a lot of different traditions. So some are from Chinese medicine, some are from Ayurvedic medicine, some are from Western herbalism, and it depends upon the individual. For instance, one herb that I use is Vitex castus agnus, which is known as chaste tree. And chaste tree is empirically been shown as to help acne, and it also is known to balance various hormones at the level of the pituitary up here.
And if I had an issue with acne and I came in, and this is something that I know people are they don't want to give up too soon and they don't want to go too long without getting some kind of result. What is the time frame that somebody might find to get help or to see that something's helping them?
It's very variable. I usually think that if there have been issues going on, it's about a month per year that they've had issues. So people come in and they want something that's going to fix them right away. And I think a lot of people get discouraged after a month or two and they leave. But they have often been building this problem for 10 or 20 years. And it's not realistic to think that you're going to rebuild your system in a very short time. I do have people who improve in a month. I've had people who improve in 7 months to the point that they don't need to do anything else afterwards.
Wow.
One case of that kind was a young woman who was very motivated. She had cystic acne, and she was facing Accutane as an alternative, and she did everything exactly, and was discharged in 7 months. But interestingly, some of the things that I did also helped her body in other ways. Now, she was in good shape. She was a runner. She was running 10 miles at a time. When we started fixing her digestion, she knocked 1 minute and 20 seconds off every mile.
Wow.
So you see, there are muscles that I test are related to different organs. And when we start fixing those organs, other things begin to function much better.
And now, how did she know to come to you? How do people find you?
Well, usually through my website, holisticdermatology.com with an H. They find me online. They Google holistic dermatologist, and usually the people who come to see me have looked all around, made some calls, and found out that although there might be other people who mention this kind of thing, there are really very few people who do this kind of work and focus on this, and if necessary, just use natural means.
And so I'd like to hear more about what kind of problems you treat. I know acne is one of them. What are some of the other types of skin issues that people come to you for?
Well, common disorders include eczema and seborrheic dermatitis, dandruff, and psoriasis. Less common issues are usually things that are either hard to diagnose or have been diagnosed and people don't want to take the immunosuppressive medications that are involved. So I had a call from a family. They had a daughter who had a condition known as lymphomatoid papulosis. She had hundreds of bumps all over her body that had as you can tell by the name lymphomatoid, had a lymphoma-like appearance. And indeed, about 10% of these convert to lymphoma.
Oh.
And she was facing 2 years of a very cytotoxic medication known as methotrexate. And as I heard the history, and I began to make some suggestions for them, and she was beginning to improve. And then I heard more about the history. I believe it came right around the holidays, which was a big sugar time.
Oh.
And sugar changes what's growing inside of us. And it was after that that she had some big changes, and we made some changes in her diet that were dramatic. And the next time I spoke to them, she was better than 95% improved.
Wow. And what was the time frame for something like that?
A month?
Wow. That's very dramatic.
A month or two, something like that, yeah. And she didn't have to go on the methotrexate for 2 years, which could have knocked out her liver, could have killed her, could have knocked out her bone marrow.
Right. Well, and tell me about. So, do you ever prescribe the type of drugs for acne that other dermatologists do, or do you?
Well, some people come to me on those drugs, and I taper them off slowly. The topical medications that are used, I often use, especially if somebody's already on them, or if they need a little bit of a boost. So I use both natural and conventional topical medications because I don't think that's affecting the internal part. I want to work from both sides, from the inside and the outside, to get optimal help for people.
Yeah, that sounds best. Yeah. So, as far as insurance is concerned, are people able to use traditional insurance with you, or do you have different ways depending on what kind of treatment you do?
Unfortunately, insurance is set up so that you see several people an hour. Some of my colleagues will see 7, 8, 12 people in an hour. I need to spend over an hour with a new patient. If I was on insurance, I would soon have to mortgage my house, and I couldn't afford to do that. I do give people a slip for their insurance, and if they have out-of-network benefits and they have met their deductible, often they can get some money back. But interestingly, the insurance companies are fairly willing, with a little bit of prodding, to pay for a $400 bottle of acne medication. But they're very unwilling to pay for somebody to bring in the skill of 3 or 4 different disciplines and the time it takes to dig the information out to find out that whole causal sequence to get a person better. I think someday that may change, but right now it's really very difficult. They want more and more production, and they forget that some of the kinds of things they wind up having to pay for are far more expensive.
Right.
As you may know, the new medications that are coming out are in the tens of thousands.
I saw that. That's horrible. I hope something gets done about that. That's really terrible.
It's a dual problem. The development of some of these things is quite expensive, and people they're spending billions of dollars on some of the new immunotherapies for cancer, and there are some dramatic results that have occurred from that. But they've kind of pushed all the prices up, and
Right.
I think that there's some room for improvement in that realm. But it does speak to the amount of energy that it takes to get somebody better.
Right.
And it also speaks to the inequality of treating people who are really expert at taking care of patients and denying them coverage for what they're actually doing.
Right.
So insurance is an issue that unfortunately keeps a lot of people from being able to see me. I would say at least a quarter to a third of the people who see me are in the trade. They're doing natural medicine of some kind, and they understand the
what
benefits.
Your approach is. Right.
Just not only my approach, but the benefits. What's interesting is that I love the side effects I get. People come to me with, say, acne, and they wind up getting rid of their bloating, they lose weight, their energy comes back. Let me give you an example. It's okay.
Yes.
I had a young woman who came to me with acne. She also had chronic fatigue. And incidentally, she had autoantibody levels off the board. And
what does that mean to me?
Well, she had an autoimmune condition that didn't even fit into the diagnostic criteria, something like lupus or Wegener's granulomatosis. They weren't sure what it was. And she was pretty tired. She couldn't do a week's work anyway. And I started treating her, and she had some high Epstein-Barr virus and cytomegalovirus titers. So there was a chronic viral load that was contributing to her autoimmune conditions, as well as all of these other factors that we've talked about in the digestion. So I used some specific treatments for that. And in a number of months, she was going to school and working 12 hours a day. And when I last saw her, she was trying to get into the Marines.
Wow.
So,
okay. So she must have felt much, much, much better.
Oh, much, much, much better. So you can. These are the kind of side effects I live for. I see people return to a normal life, and this is where people are willing to make an investment.
Right.
Because the other alternatives are not so good, and that's opposed to people who might be put on antibiotics for their acne, who might get better, but also might wind up having
problems as a result
from
of that.
With the wrong organisms growing, and then they have to deal with that. I've also seen that with Accutane. Some people get into trouble from Accutane, and then they're chasing.
Let me ask you a question, because we don't have a whole lot of time left, but I wanted to get to one of the things that you do to determine what people need in their system. I know you have a few little things to show me as far as muscle testing. This is one of the techniques you use?
Yes.
So can you tell me more about that and show me how that works?
Muscle response testing is a technique that was developed by chiropractors.
Okay.
And if you focus on an area of a problem, or you put something that's problematic into your body under your tongue, it often causes weakening. Let's try it on you. I'm going to have you just pull up a little here.
Okay.
Hold your arm up and don't let me push down.
Okay.
Okay, good. Got it like that? Let's pop this under your tongue and see how you do. Just hold your arm up for me.
Mm.
Just hold it up for me. Mm. What's the matter? It doesn't work?
No, it's difficult.
It's
difficult. I lost some of my strength for sure.
Yeah?
When you did that, yeah.
So anything that causes problems is going to weaken a strong muscle. And then we can test various things using specific muscles and specific remedies to see which strengthen you up. So it's a way that I take what I understand to be going on and refine it to make better choices among the different supplements or herbs that would be beneficial.
So you would put an herb under my tongue and then try this and see which ones would be the most beneficial?
Well, either under your tongue or into your body's energy field, over your solar plexus, under the south pole of a magnet.
So you would be holding it there, as opposed to, okay. And that's a technique I've heard about, but we haven't discussed on this show. But yeah, that's interesting. And muscle testing, you find that to be very effective?
I think it's very effective. it's not absolute, but it really helps you hone in on what the most likely things are among a couple of different things that might work.
Uh-huh.
And also it helps you hone in on things that a person might be sensitive to, like you
Right,
had
I
with
told
this.
you I sneeze from that, and so I'm not surprised.
Uh-huh.
I'm not surprised that that weakens my
Well, we
energy a
can
little
try
bit.
plain sugar if you'd rather try that, but I'm sure we'll get the same kind of response.
Yeah, yeah. We only have a few more minutes now, so I just wanted to take a moment to talk about the book that you wrote.
This
And
is the this is the book Radiant Skin from the Inside Out, and
tell
it's
me what you focus on in that.
well, I can't treat all the people who need my help, and I wanted to get this out to the world so that other people can understand the immunology. They can understand the whole idea of what's behind a natural treatment, which they can either use with their practitioner or use parts of in conjunction with their other treatment. So they understand the immunology, the science, and a lot of the lore behind a natural approach to treating not only skin conditions, but inflammatory conditions in general, because this is becoming a big problem in our country.
Right,
So much.
right, I know. There's a book called Inflammation Nation. Do you know that book?
I've heard of it.
Yeah, that talks about just, and a lot of it is the things that we eat. You know, it'll go down and it'll tell you which foods have high amount of inflammatory substance. And a
Well,
lot of our diet, a lot of the typical
yeah.
diet is very inflammatory.
Well, I also point out the specific nature of that, and that's based on my work that we did at the Cancer Institute. And I think it's important for people to understand this in a deeper sense, not just this food is this and this is that, because it's very specific to the individual. And when you read this, you'll understand why it's specific to the individual.
That's wonderful. So the book is called Radiant Skin from the Inside Out by Dr. Alan Dattner. Thank you so much for being our guest today on Ready to Heal, and we'll see you next time. Thanks. Bye-bye.